You've got a great patient story and a great patient success story of a young lupus patient where you essentially saved his life. Can you tell us a little bit about that story?
So this is a 22-year-old, very young, of course, African-American gentleman that a few weeks before he was admitted in the hospital, he was doing exercise and he had to stop doing his exercise because he started to have severe pain in the left calf, something like that. So he went to the emergency room because he was in tremendous amount of pain, and they told him that he probably, had a sprain of a muscle or a tendon or something like that, and he was sent home. A week after that, he was again in the emergency room because he had acute shortness of breath. This time they look further. They diagnose him with a pulmonary emboli. He did not have any, risk factors. I mean, he was heavy, but pretty active. They start the anticoagulation, and in 3 days, they sent him back home. He started to be very confused, combative, and he lost his consciousness. In a couple of hours, he started to transform from a normal person to someone that lost his consciousness. So they thought maybe he had a brain bleed or something. So they brought him to the hospital. The gentleman ended up in the ICU. And being there in the middle of all these tests that they were doing, they also did a CAT scan of the head, and that was followed by an MRI. And they showed that he had severe inflammation of his brain. So nobody knew why this young gentleman would have something like that. Luckily, one of my residents, she rotated with me a few weeks before she saw this case. So she went straight to his family, asked questions, and they identified that maybe someone in the family had lupus or something, autoimmune disease. The question was an autoimmune disease. So the resident ordered the NA. The NA is positive. And guess what? With a positive NA, who do they call? The rheumatologist, of course. So I got involved in the case, and indeed the patient had lupus with brain involvement, actually. We treated this gentleman, and from someone that was not able to talk, I did not talk to him at all through that whole hospitalization. From a gentleman that was not able to talk, when he came to see me in the office, he was walking, talking, and today he is back to his normal life. He was saved.